Hey everybody, we're back with another episode of the Raad Life. And if you're like me, you've spent a good amount of energy for a little bit, at least last week, looking for masks and figuring out, how come I can't find masks anymore? I mean, a lot of people probably bought a heck of a lot of toilet paper, but did anybody buy masks? So I know it sounds kind of funny, but it's not, and it actually has a lot of ramifications. And people are desperate, and it's not just you and me. It's people that are basically caregivers and in hospitals. The supplies are not there, and the federal government isn't really stepping up to force people, for example, to manufacture them. I don't know why not. I mean, they should be basically going to manufacturers saying, listen, you just got to manufacture masks and gloves right now. That's it. You just do that. Any paper manufacturer, that's it. We're buying everything you produce. So there are people that are stepping up. Like we said yesterday when we were talking to Jay, there are people that are stepping up to fill the void, to take care of things. They're stepping up and basically showing leadership. And one of those people happens to live in San Clemente. He's a friend of mine, friend of my sister's, Stephanie Oddo, who is going to be on with me here in a minute. And I want her to share her story because, again, keep in mind, guys, it's only been a week. It's only been a week, okay? And here we are, facing unbelievably new conditions, and there are people that you wouldn't expect. I didn't expect this to happen from Stephanie. I mean, I don't know why I wouldn't expect it from her, but boy, it's a great story, and I really want to bring this to you because it's having a very positive, ripple effect, and I'm going to let her tell it. So I'm going to bring her in here. Stephanie, are you with us?
I am. Hi.
Okay, hi. So I was just saying that, we probably, a lot of us basically just went out and bought a heck of a lot of toilet paper, but we didn't buy any masks. And now we're going, oh my God, I need masks. And we're not the only ones. There are caregivers that are needed, people that are basically on the front lines that need it. The federal government isn't really stepping up. I don't know why nobody's giving orders to paper companies or anybody that does filters of some sort to just, look, produce everything, all retooling machines, produce only masks and filters with filters right now, produce only gloves. We're buying everything from you. We're distributing it through the National Guard to all the states. That's it. That's all you're doing for the month of April and May. That's it. There's no guidance to that. Nobody's saying that to anybody. So I'm going to basically want you to share with everybody your story. Like, you are stepping up to fill a void. How the heck did that happen? What is it that you're doing? How can people help and get involved? And let's educate some people on this.
Thank you, Rod. I got involved because I learned to sew at a young age. Someone posted a video online of a hospital that was issuing a call to action. They needed people to sew masks for them. And that hit me. I thought, well, it's a hospital. This is one of our most trusted institutions in our country. And they
Shocking.
Right, and they need me to make a homemade mask. So I thought, let's do it. I'll get the kids involved. It'll be a great project. And I thought about it a little bit further, and I went through some old material, thought about it a little bit more, and I thought, I'll start a Facebook page, and I'll get maybe some other people to join up, and we can collaborate, and we can figure out how best to do this. Mm-hmm. I did that at night on March 20th. It's been 5 days.
Today's the 25th by my count, right? So it's
today's
not even a week. It's not even a week.
It's not even a week. Our group, I got so involved in the Facebook and managing the Facebook. The response was overwhelming of mostly women in the community who wanted to sew masks. And they all just jumped in. And I had, a couple moments where I was so overwhelmed with emotion, and the gravity of the moment did not leave me on how incredible this was about to be. Mm-hmm. And that's what's fueled me. And I have been managing the Facebook site ever since, and I have not sewn a single mask. But what we've done is we had masks out to a doctor's office in the first 24 hours of making our site. We have now done, we're already over 500. We've already supplied over 500 masks to healthcare workers.
Wow.
Yeah. So that's kind of where we are.
So is it really through social media that the word is getting out on all the masks?
It's really the only way. Also, the healthcare system has kind of found out about us. Mission Hospital doctors and nurses are talking about it. They're guiding people to our site. The hospital has approved.
By the way, I love the fact that you're also doing spring colors. Okay, so let's just point out from an aesthetic perspective, or if you're into animal print, right? I mean,
we will do anything. In fact, the only stipulation that the hospital has
adult,
said
child size. I mean, you know,
yeah.
5 days, ladies and gentlemen, 5 days. We've got adult and child sizing. We've got, you know, nice florals. We've got animal prints. You want zebra, you want leopard, you know, your preference. We've got this picture just blew my mind, you know, with all the masks on it. It was just like unbelievable. And the fact that you have had such an outpouring of support. I mean, okay, little surfer Hawaiian thing going on over there. It's even got a little Bible verse kind of written on the bottom corner there. It's fascinating. It has. Do you think that it's given people like sort of also who needed it a purpose?
The sewers?
Yeah, like
Yeah.
like a purpose to actually feel like you can actually, because this whole crisis to me seems like such a frenzy, like such an I have no control about my life. Every aspect of my life has changed. My kids are at home. All of a sudden I'm house schooling and I'm the cafeteria mom and I'm the, you know, everything. And I still have to find time to work if I happen to work, because the companies really haven't shuttered, and I really don't want them to shutter because that's my job and people are losing their job. Every aspect of society has been affected. And you feel so out of control, you know, unable to control your reality. So having a purpose that you can basically gravitate to on a daily basis in something that is genuinely going to have a positive impact on so many people, and through the caregivers and the nurses and the medical professionals, have a ripple effect on beyond yourself and your immediate society. I mean, I can't imagine that not being a positive thing in somebody's life right now.
Oh, all of the people that sew in our collaborative are extremely honored and extremely excited. And I mean, they finish the masks and I get a message. I finished 15 and I'm on it. I'm like, okay, next one on the list. And then I send a message to the healthcare provider. And I said, I've got 15 for you. Can you go pick them up in Mission Viejo? Here's the address. You know, we get rid of them as soon as they're made. And
you have made 100 masks basically, by my count, per day, right?
I mean, that's what we're averaging.
Wow.
But we have just procured a lot of material. It's been a challenge to procure material that is in high demand. The costs have doubled, and really right now very hard.
That to me is just insanity too. You and I were talking about the fact that, you know, if you didn't get your webcam, forget it. You're not going to find one right now, right? And if you find one on eBay, it's like 3 or 4 times. They used to call that wartime profiteering. Okay, I mean, that's really what's going on. It's kind of insane. I'm going to put up a picture about the mask with the elastic, right? Let's tell people about this, because to your point about resources being finite. Okay, so there's the mask, and that looks like at one point in its lifespan used to be an elastic. Okay, talk about it.
I love this sewer for trying this, and I love that she tested it out before she gave it out as well. And that is, you know, we really need 1/4 inch elastic. And people are finding 1/2 inch elastic, and they said, can I cut it in half? You really can't do that unless it's beaded elastic. So this particular sewer gave it a shot, tried it out, washed it, and it didn't work. So we have had a lot of challenges, but we have met that challenge. I have some sewers, if they can't find elastic, they're sewing them with the material, their own ties. They're using hair ties, they're using ribbons, and they're using shoelaces. Mm-hmm. So we will do whatever it takes to protect our healthcare workers, even if it's just a little bit more than if they had nothing.
Well, and how effective are these masks, Stephanie? I mean, they are obviously they're cloth. They look like they're surgical masks, but the material is not necessarily the same stuff, right? I mean, the closest I would say is maybe like a surgical green mask, right? How effective are they under normal conditions, and how effective are they given the fact that we are trying to ward off basically the coronavirus?
Right. Well, the only information that we have to go on is an article that was published in Forbes. During the SARS epidemic, there was a study done on fabric effectiveness. And we know that a surgical mask offers 97% effectiveness against 1 micron particles. A vacuum cleaner bag, 95. Go down to a cotton t-shirt. Just take a cotton t-shirt, for example, 100% cotton, 69% effectiveness. Pillowcases, and we do have some people that are grabbing their sheets and old sheets, and they're making masks out of old sheets. That's going to be 62% effective. You know, and at first I wondered if that was okay. But when I saw how many people who were doctors and nurses and healthcare providers asking me for masks, I realized it was indeed very needed.
62% is still better than zero.
Better than zero. Better than zero. And so we're just trying to fill that gap until some of those big companies, I mean, I hope those big companies can deliver, and I know that will get out there, but they're not here now, and we need them now. We have Corona now in our community. One hospital.
I don't know. I'd rather have a leopard print mask to wear than one of those ugly white ones or blue ones. So, you know, put me down for any animal print that you got. I'll wear it on the air. But no, it's true. I mean, and it's a sad situation that we can't have the infrastructure to support this in a time of crisis. But wow, what an achievement! What a positive story! How many sewers do you have working on this?
You know what? It's kind of unclear. I have a sign-up sheet, but I can't tell you how many sewers I have because I have been managing this myself. I'm going to get some help. I'm going to get some people.
Are you even sleeping?
I'm kind of, but I wake up and I go to bed. I take a break I try to take a short walk and 3 meals. But my thing was I just wanted to get those masks out as soon as I could. Just get them out. Now we're looking at getting more organized. I'm looking at getting more help. So I can't tell you how many sewers I have. I'm going to guess about 50. That's a guess, maybe 40. I'm not really sure.
That's still very, very impressive. I mean, it speaks to the power of social media in a positive manner, right? I mean, we gripe about social media when everybody's basically lambasting everybody and everybody's in everybody's face. But here's a positive message, if you will. You know, let's see if it actually holds after the day after coronavirus is done medically, right? We'll see if we go back to being sarcastic and cynical to one another. But here, this is a really positive thing. And you spoke of the Forbes report that you were mentioning, right? Is it any particular title? Can you share that for anybody who's interested in looking at that?
You know what? I have the graph. I'd have to look.
That's fine. I'm going to put the graph up, and you can go over that. We can share that on the Facebook page later.
It is on the Facebook page.
Right, and you guys, I'm going to put it up again. Go to the Facebook page, COVID-19 Healthcare Mass Collaboration, South Orange County, and then all this information we're talking about is there. All these pictures are there. You know, I'm putting a markup or a promo on anybody who orders a leopard skin mask, but you know that's a different story altogether, right?
You know,
yeah.
Rod, we also have, if anybody wants to make their own masks, we have patterns, we have videos, we have patterns for people who are beginner sewers, people who are more advanced. We're telling our more advanced sewers to sew a opening for a filter. So if they have, if you can put a filter in, and then the doctor can
something you're talking about something like this.
Exactly, and they can replace that filter every day. I mean, it can be anything from a tissue to a coffee filter to a vacuum cleaner.
You know what I find fascinating about this is I have family members that are doctors, and I know that doctors, one of the things, because they're all in scrubs, they're all in like their lab coats, you know, one of the things that they do to differentiate themselves usually. I have an uncle who basically prided himself on this with the most, you know, bright and fluorescent colors he could imagine. But he would wear fun ties. He would wear kind of like, you know, something of that nature. So I find it fascinating that something as common as a mask in a hospital, that we don't already have something like this that's out there, because you would think just in terms of usage, something like this would be a way to basically put on a personality, lighten things up or whatever. And then if it has a replaceable filter component, that would again be a lot less waste on disposability, right? I mean, you can wash these things and then basically just replace the filter. So here's a business opportunity for everybody's looking, although, you know, Stephanie may already have, you know, copyrighted this at this point, at least for South County. But here's a great idea. Now, you and I were kind of joking a little bit about what could be used for a filter, right?
Yes, we were.
And you touch on a little bit like about, like uh, uh, vacuum cleaner bags. So say some of the things, and I said, well, what about, unrolled tampons or sanitary napkins? And you didn't like the tampon idea, but then you're like, well, wait a minute, the sanitary napkin may actually hold some merit, right? But let's talk about that. What if somebody wanted to do this and went to your website, and I'm going to put it up again, went to the website and found the pattern, right? Do you have one, for example, for a replaceable filter? Could they make themselves one with a replaceable filter?
We do, and we encourage the replaceable filter. And in most cases, the healthcare provider is going to find that filter for themselves.
Yeah.
Some of our sewers may have some things to give them, but in general, they're going to find that for themselves. And so, just based on the Forbes report, a vacuum cleaner bag is supposed to be very effective. You could cut that up. And again, we've seen things just as simple as tissues used. I think it's really anything. And I think the fact that it's replaceable, that it could possibly catch something and you could get rid of it.
Well, I mean, I remember I did not get masks, but I got gloves. And I remember when I got a sense of this, I got gloves and I got washable gloves because I figured I would just use them. Now, my stupidity is I bought only one pair. I should have bought two so that I have one always clean and one. Okay, so I'm learning. But,
and I wish I could give everyone 2 masks for that reason, so they could wash it at night and leave it in the wash one day and then wear it. But
find an old shirt, find an old something, and make yourself 2 masks. Now, so you can't use the elastic, but like we said, you could use shoelaces. You could use something different. It doesn't have to be necessarily an elastic component. Or to be honest, what about all those disposable masks that get thrown out that basically have elastic on them anyway?
That's a great idea. There is a pattern
recycle the elastic of the disposable mask.
There is a pattern out there that you could actually insert the disposable mask into the slit. So if you're
okay, so do you know when it comes to disposable masks, how many times can you use it?
Well, I don't know. I do not know the answer to that, but it's my impression that they use it and they're done. They throw it out after the procedure with each patient. I would guess.
That's what it's used. But I mean, is that because we have a plethora and a lot of volume available at normal conditions? And in fact, this is something that could be used. Let's not say in a medical situation, but let's just say for people that are walking around. Like, is this mask that is usable for me if I keep it in a sort of a pristine state and I don't spit in it or sniffle in it or whatever, that I can actually leave it in my car, for example, or downstairs, or use it over a course of a week? And that could be an interesting piece of information, actually, because I have 2, and I use one of them, and I keep it in the car right now. But I have no clue. I mean, I'm using it because why wouldn't I? I'm the only one wearing it, right? But,
right. Well, I would rather you wear one of our masks and wash it than keep a disposable.
I keep fishing for the leopard print mask, Stephanie.
I'm going to try to get you. I'm going to try to get you one of those, Ron. I'm going to get you one of those. I can do that. Yeah.
So let's go back to the filter for a second, right? So doing the filter, and you and I were talking about looking into the air filter, because you said something about the fact that fabric alone has like 60% blockage, right?
Right.
So the simple rationale is, if I put another element inside that, now I've added the barrier from 60% plus now. So right?
I can't make any guarantees, but it makes sense to me that if you add one of these other materials, like a vacuum cleaner bag, it's going to help, and you can throw it away and get something new and put that in there. It just makes sense.
I want to go to the chart, but before I go to the chart, I want to point everybody out again to the site, because there's something that's kind of funny. I thought it was very cute and it was very funny. You had a video where somebody actually used a pair of boxer shorts.
Oh, that was an Italian video, and I thought that was ingenious.
Of course, it was an Italian video.
That was kind of a funny. That was trying to lighten things up.
No, I know, and that's why I'm saying to people, go to COVID-19 Healthcare Mass Collaboration South Orange County, because not only will you find useful information, but you'll also find some funnies from Italy, right?
Yes,
and I'm gonna just leave it at that. Exactly. I'm like, what are they gonna do with the other leg? And I'm like, oh my God, that was pretty cool, right? So, and for all you skiers out there, it's what everybody's wearing in this coming season. Just go get a pair
You
of
know,
blockers.
talking about skiers, Rod. Actually, one of the first people that came to me was from a skilled nursing facility in Fullerton, and he said, "Stephanie, I have ski jackets. Can I drop them off at your house? And can you make me some masks? Because it's a waterproof material,
And it has the
he
padding.
he felt that it would provide better, and it does. Unfortunately, you have to be a pretty skilled sewer and have the
Yeah.
right machine and the right needle to be able to sew that kind of thing. So we're not focusing on that. But that was my first person.
Well, also from the person who's had some of those that were Velcro attached to the back, there's actually holes in it. So you would have to find another filter blockage on the inside. And yeah, now that I've said that, now any sports stores that are still open are going to basically be out of ski masks, in spring. So go figure.
Yeah.
Yeah. Let me put up the chart. I want you to go through this chart. Okay. So I know people can't see the details on the wall behind me, but this chart is available on your site, right?
Yes.
Okay.
Yes.
So let's go through this. What are we looking at the top there?
Well, like I said, the surgical mask is 97% effective against these
Right.
1 micron particles.
That's the top line on here. Yeah.
Exactly, the top line.
Right.
The next line is a vacuum cleaner bag, 95%, which kind of makes sense because that's what you suck up all the dirt in your house on.
Well, and you don't want to getting back into the environment of your home once it's sucked up. So yeah, absolutely.
So those are pretty good. Next is a dish towel, 83% effectiveness. A cotton blend is 74%. And we're using a lot of cotton blends. Some sewers are using 100% cotton, but we're also using cotton blends. So some of our masks are going to be probably at their best, 74% effective.
Mm-hmm, mm-hmm. Well, it's still, like we said, it's 74% versus zero.
Versus zero, yeah.
Yeah.
Then you've got a cotton t-shirt. A little bit more complicated to sew. That's 69%. Antimicrobial pillowcase, 65%. If you have a scarf, it's 62%. So I guess in a pinch, if you're walking around, you could wrap a winter scarf around your nose and your mouth.
I did do that for last week a number of times where I basically had a scarf on because I would basically be able to use it as a mask until I got my hand on a couple of masks. Yeah.
Yeah, very good. Yeah.
And the weather is still cold, people, so you won't look odd if you're wearing it. Yeah.
You know what? I don't care how I look, Rod.
I'm just saying, okay, yes, the first week we don't care if we're dyeing our hair or we're going, all the hairstyles are off,
Yeah.
And I can't get my manicure, pedicure. I get that, right? But at some point we're going to go back to, I got a little vanity. So
right.
all I'm saying is it's still cold, wear a scarf. It does dual purpose. That's all I'm saying.
Exactly. Yes. I went to CVS with bright purple gloves on, all the way up to my arm. So whatever it takes.
If I was doing a fashion show that just got canceled, I would just have all the models that were going to basically show. I would make sure that they all showed their gloves and their face masks. And if you want to learn how to sew your face mask, here's where you go. You go to COVID-19 Healthcare Mass Collaboration, South Orange County, and by the way, how are you guys covering the cost of all this? Because we're making a little bit light of it, and I'm really happy to have a positive story to tell here. But how are you guys paying for all of this?
Okay. So what we do is, I really don't encourage my sewers to run around because it's really against the governor's order. I mean, we're supposed to be staying in place, and we want to be a part of the solution. We don't want to be a part of the problem. So I'm encouraging people who may not have things around the house to sew to get in touch with me, and I'm connecting them with donors. So I'm having donors who say, then we have a whole set of donors who say, I want to help, but I don't know how to sew. What can I do? And I said, buy some elastic. Yesterday, for example, we had some donors get together and we bought enough elastic for almost 5,000 masks to be made. We, for $43, we secured an elastic roll that would service almost 500 masks.
Stephanie, I know you're not, it's not like this is a very grassroots thing, but possibly like a GoFundMe or some sort of donation place for people to be able to donate that may not be able to secure sources. I don't see this going away anytime soon. And if I had to guess that we're looking at least a couple of months. And then there's probably going to be that sort of like ramifications of me, the fear, like, wait a minute, we've been under, kind of these conditions so long, it's going to take me a little while to get out of this sort of fear zone. So I will bet you that even if we're no longer social distancing, there may be people walking around, that we in the past would laugh at seeing them wear masks. I mean, we used to say that a lot of the people that are either Japanese heritage or whatever, they were wearing gloves while they're driving, and they may be wearing a mask when they're in public. But I bet you that this is going to go on. So for you guys to continue to play this role, right, which I think is very critical, and it may get a little less critical, hopefully, but I think there'll still be a need for it. You should probably figure out a way to fund this thing beyond just donations, because you're going to get more sewers. You're going to need more materials.
Yeah.
By the time I basically have shredded my second pillowcase that I have in the house, I don't know if I have any more to spare. So, and I'm more than happy, by the way, to put you guys in touch with some people that are on the design side of things, like the design industry, that may have some remnants of fabrics and things of that nature. We can put the word out. I'm actually doing it right now. Anybody in the industry, in the design industry, or members of ASID, or anybody that's got, I know that designers have fabrics in their garages that were leftovers from jobs all day long. Okay. Contact Stephanie. Here's the website again. I know I'm shameless plugging this thing. COVID-19 healthcare mask. You're welcome. Collaboration South Orange County on Facebook. Figure out a way to get that material out of your garage. Spring cleaning, designers, get those fabrics for some good use. I know you got leopard print, people. I really do. Right? Probably some zebra print too, right? And this is coastal California, so I know you got some Hawaiian and florals and all this tropical stuff. So let's put it to some good use. Here's the website again. Contact Stephanie. And now, I think you should probably consider doing that. I mean, I think it's a very worthy cause. It's not just the end users. I mean, you're educating the people to make their own mess. That's awesome. Continuing to find out more information about this in terms of what is the filters that you could use. How can you, MacGyver something in your home to make it work for you, right? But at the same time, you're also providing this for people that are in the healthcare profession. You were telling me that you've got people in the adult care, daycare, that reached out to you, right?
Yeah, I can tell you about the people that have reached out to us. I mean, we have had, a corporate nursing home reach out to us for 3,000 masks. We've had, like I said, home healthcare providers, certain departments at Mission Hospitals, certain departments at Saddleback Memorial Care, nursing homes. Nursing homes don't have anything. And we all heard about what happened in Washington.
Oh,
and
yeah.
I want people to remember that healthcare workers are brave people, but courage doesn't mean you're not scared. It means you're still scared and you're doing it anyway. Right. And these people have courage, but we as American citizens, we should be grateful and we should be responsible for them, to take care of them, and we should provide them with what we can. And so that's where we're coming from. We feel very strongly about that. And so when I get a message that someone needs something, I can't get it to them quick enough. I wish I could just get it, but I can't.
What is we're on to wrap up here but what is one thing that you have been you've been floored by in terms of that has affected you, that's positive, and what have you seen that has been very challenging and really affected you? Do you mind sharing that?
Well, the positive thing is, and it's hard to say because I'm a little choked up, but the positive thing is the compliments we get from the healthcare workers and how grateful they are. Because back to my point about courage, they are scared. They're human beings. And if we can just take a little bit of that fear and stress, we need those people on our front lines in a very practical way. We cannot lose those people right now. Those are the most important people in America right now.
Absolutely.
And we need to protect them. And so positive, I would say those compliments. We have some photos of them wearing the mask. That is beyond moving. I have trouble, I'm holding back the tears on that one in a really positive way. So that feels really good. In terms of negative, I feel proud that we're stepping up to fill this gap, but I feel sad that we are having to do it.
Mm-hmm.
For example, a message I got from a hospital in Pismo Beach. Hospital has many COVID-19 patients and out of supplies. So when I'm looking at mission and I'm going, okay, I need to get you guys supplies for your other people, and then I'm getting this message, it floors me. It floors me how unprepared we are.
Well, my friend, you know, sort of shore yourself up, because here's what I have found happens when you step into this void, into this space that is so critical, and regardless what it is that you're going after, or whatever it is that you're basically engaging in, but just when you do that and you are effective, the need is so much compared to what the resources out there are, and all the good intended people, and all the, you know, it is so the magnitude of the need, whether it be seniors, care, whatever, and here this particular thing, that the minute the word gets out, there's almost like a drowning person's need to reach out and try to get help. And so you cannot help everybody, but you sure can at least try to educate people to do it for themselves. And you said to me that you had friends that were from Florida that reached out, and that this is not limited only to South Orange County now. There are other groups that are forming that are using this example. You've kind of figured out the rubric, if you will, and now they're basically putting it into effect in their own communities, and they're taking that opportunity to rise to the challenge of being faced with the crisis in their own communities and being positive in their own communities. So that in itself is also a ripple effect that is meaningful. But yeah, it is very sad that we have to do this. But then again, it's not the first time we have been challenged, right?
That's true. And we will get through this. This too shall pass. And I am optimistic of that. And I am totally confident in the American spirit and the human spirit to survive this. And I think our group embodies that. But yeah, to speak to that last note, we have inspired others. And that is another positive note. Like you said, I have people in Minnesota, New York, Florida, North Carolina, people all over the country who are watching what we're doing the same thing that we're doing, trying to model that. And so I'm super proud. I'm super floored. I'm humbled. I just, it's been an amazing experience so far.
So I'm going to make a prediction. Okay.
Okay, Raad, what do you got?
Okay. I'm going to predict. Oh, this is a fun prediction.
Okay.
I'm going to make a prediction. I'm going to predict that homemade, bespoke, custom face masks become a fashion statement. And I bet you that happens before we're even out of this. Because have you noticed that there's been a lack of selfies taken lately?
Oh, I didn't think about that.
Yeah, there's been a lack of selfies taken lately, because who goes, no, I can't get my clothing. I can't be seen in front of the restaurant that just opened, or the fancy car that just got launched.
True.
You know, as an influencer, I'm not basically seen at the restaurant drinking their latest cocktail, right? Yeah. And I can't get my hair done, and I can't get those curls just right. And, you know, who's going to do my makeup and all of this stuff? So until I learn to go back, you know, and some people have that innate skill set built in because they've done it in the past. But we have become such a society where we go and get these things done that, you know, I've noticed a lack of selfies lately. So here's my both invitation and challenge to everybody who's listening to this. First of all, once again, contact Stephanie. Here's the website, that's Facebook, right? Figure out how to make your own mask, or Stephanie, you need to set up a thing for people to donate, and maybe part of their donation is that they get maybe a mask.
We will provide those to healthcare workers. Right, absolutely.
Right. Okay. To healthcare workers, and you don't know who got it. And basically, people, put on a mask. Make your own mask. I mean, if you're in Minnesota, I'd like to see some flannel. Okay. If you're in Tennessee or in Wisconsin, how about some of that hunter orange, right? Let's get creative with these masks. You know, somebody's got a shirt that's basically sentimental or whatever, you know, wear it with pride. Where are we going to wear it? It's got holes in it. Make a mask, put it on your face, take a picture, send it to the Raad Life on Facebook. We will post it. We will have a voting on this, who wore it best. Okay. and we will turn it into something to be proud of, because I really salute you, my friend, really honestly. I mean,
Thank you.
it's out of
Thank
necessity,
you.
I understand, and stepping up to the plate. And you know, when I had Jay, who's the director of Center of Leadership from Cal State Fullerton, yesterday on, I said, or he said, you know, it is times like this where people will rise to the occasion. Leadership will rise, and it sometimes isn't from the sources that you know. I mean, I know you. It's not like, why would I not think that you would do this? But you know, to connect the dots, and I want to say thanks to my sister Rada for basically bringing this to my attention, because I'm like, what's Stephanie doing?
Thank
And
you.
it's
Thank you,
very
Raad.
meaningful, and it's a
Thank
real
you.
genuine positive effect on people's lives right now, and it's very much
Thank
needed.
you.
And it's a sad reality that we don't have enough, but you know what, kudos to you for stepping up, and to all your stores, by the way. I mean, this is not
All the
by any
sewers,
means, yeah,
all the
I
sewers, I
recognize
can't
it.
do it without them. Cannot do it without them. Thank you so much, Raad. Thank you.
My pleasure, and thank you for being on. And hey, everybody, I want to know that you visited this, so you go visit it, and then, you know, pay attention. And I'm telling you, I will find some way to reward the person who wore it best. So go make your own masks, wear them, post them on the Raad Life, and we will have a voter selection of who wore it best. I don't care what the
Perfect.
fabric is. Okay, and
Perfect.
I expect my leopard mask, so I can wear that
I
as
gotta
well.
get you something. That's for sure. You're gonna get something in the mail sometime soon. Who knows
Thank
what
you,
it
my
might
friend.
be?
No, I probably, okay. I better have a mask before I open it then. All right. Have
Thank
a great
you.
day. Bye-bye.
Thank
Thanks
you.
everybody
Bye.
for joining us on the Raad Life. Bye-bye.